Now, sometimes we are asked that once the embryos are formed either by IVF or ICSI, which day we will get the embryo transferred, whether we want day 2, day 3 blastocyst or a morula, what is the better options. Now, to discuss all these things, we need to know what is a cleavage stage embryo, what is a morula, and what is a blastocyst. So a cleavage stage embryo is the embryo beginning with a 2-cell stage and up to, but not including the morula, that means the day 4 embryo is called a cleavage stage embryo. And the morula is usually a day 4 embryo, and it is formed after compaction, and it is usually seen after 4 days of insemination in case of ICSI. And blastocyst is a more advanced stage of embryo that happens on the day 5 or day 6. And the blastocyst contains a fluid-filled central cavity called blastocyst, and the outer layer of cell called topoectoderm, and inner cell mass. So this is a blastocyst. Now, which one is better? Now, the pregnancy rate of a single blastocyst when compared to a cleavage stage embryo is more. But if we see the overall pregnancy rate, there is not much difference between the 2 or 3 embryo transfer in a cleavage stage and then a single blastocyst, because here we are getting more number of embryos. Now the question is, which embryos are better to transfer, a cleavage stage embryo or a morula or a blastocyst? Now, if we go into the data, the extension of culture in case of blastocyst offers certain advantages, and this includes a higher implantation rate and live birth rates, probably due to a lower rates of aneuploidy, or means abnormal embryo, and a better synchrony of the embryo with the internal environment, because in a natural cycle embryo gets implanted around day 5 of fertilization. Number 2 is the opportunity to select a better embryo in case of blastocyst, because if there is any abnormality of the embryo, they won't go up to the blastocyst stage, they will perish in between. Third advantage is that we can transfer less number of embryo. If we have a good blastocyst, we can transfer 1 blastocyst instead of 2 or 3 cleavage stage embryos. So the chance of twinning or twin pregnancy or multiple pregnancy is much less. And better synchronization happens between the embryo and the endometrium, as we said, because there is it's more like a natural way of selection.